So a lot of you know who I am. You probably heard me. Donna Burt. Catherine introduced me, obviously, so I won't waffle. Look, I'm going to talk about occupational health in the construction sector, and I just guess I want you to take away from it what you can do a bit better out there today. And I look around and I see quite a few people that I know, and what always concerns me at these sort of events is that I'm talking to the converted. But there are a few unfamiliar faces, so which is great. And I guess if nothing else, the people who do turn up to these events a lot can influence other people. So we do rely on you to do some of that and work with you to do that. So let's look at occupational health and construction sector. Catherine said that we go on and on about safety, we manage safety, we have site safety plans, triple SPs, we talk about safety every day, well not every day but quite a bit. And so who thinks they manage safety well out there? Reasonably well. Give yourself some credit, I'm sure some of you do. Okay, not many, obviously. Okay, that's all right. And if you think you manage safety fairly well, put your hand up again. I'm quite bossy. You'll get used to me. Keep your hand up if you think you manage health as well as you manage safety. And I'd challenge anyone to keep their hand up. God, you're brave over there. I'll come and talk to you later. Look, that's good. If you think you do, that's brilliant. So can you share it with other people. This is what we see. 75 people die on the job every year. How many weeks in a year? 52. So that's just over one a week. But look how many die every year from work-related diseases, as Catherine mentioned. Then that's low. That's not even right. That's based on really basic data. So we know that there's a hell of a lot more. And in fact, I'd probably say well over 1,000. So you go on about safety all the time as you need to. You do need to get your safety in order, but you really need to step up in the occupational health space because that's where people are dying. And we've just ignored it for too long. I've been knocking around for a while, and some of you know that. And in the 90s, I was talking about some of this then. For God's sakes, I'm still talking about it. Has much changed? Not a heck of a lot. So the challenge for you guys is to walk away today and do one thing different in the occupational health space, and hopefully this will give you some ideas. And you can always nab me at the end of it too if you like. And the inspectors are there too. I've schooled them up so they know what to say. Okay, so as I said, people just don't know about occupational health. People accept that a noisy or dusty environment is just really normal. The number of times, because I'm out in the field a bit and go out with the inspectors as well, it's not unusual to go past a really noisy site and no one's got hearing protection on. It's not unusual. And I went past a site last couple of weeks ago, and I was on the weekend, and I was racing to piano, because I play the piano, and I was a bit late, as I'm always a bit late, and I went past a site and there was just dust everywhere. The guys were cutting concrete. They were immigrants, for a start. There was a Maori worker with them who was smoking. They had on hearing protection, but it would have been silica dust because it was concrete, all through the air. They had absolutely no respiratory protection on. There was no water. It was just really poorly managed. Now, if that had been during the week, because I can't be at work every day, I would have stopped and asked them to stop work and probably put a prohibition notice on them. Because that's just really dangerous practice. Now, some of you might think, oh my God, that would never happen on our sites. I'd challenge you that it would happen on your sites. Remember, this was on the weekend. There were no supervisors on site. There was no site foreman. There was no safety manager, because they work Monday to Friday. So think about what goes on the weekend, people, because we see them out there on a Saturday. Okay, we're complacent. People don't know what's going on. The main things that we're focusing on in construction are noise and airborne contaminants. We can't do everything. So we've looked at what are the highest risk activities out there, what's the most risk that people are placed at on a daily basis, and these are the ones that we're seeing. And the ones we're focusing on really for this year are asbestos and silica, and there'll be a lot of work around solvents as well coming through national programs. Everyone knows about silica, don't they? Pretty much, we all know silica is really dangerous. Did I say asbestos or silica? Asbestos. But silica's just as bad, okay? So we've got a bit blasé about other things that aren't asbestos. We've managed asbestos, but we need to start stepping up and managing other things too, okay? So Catherine talked about the Silica Dust project. From that, the aim with that project was to identify what issues were out there and then develop a program of work. So that's what we'll be doing. And we will work with industry to get up to speed on that. We'll talk to you about what needs to happen, and we want to get your buy-in for that process before we move into the enforcement phase. But the plan is that we will move into enforcement within 3 or 4 months of that work program. So it's going to be very quick. But we want to work with you to get you on side to see what needs to be done out there to manage it. So hopefully, by the time we move into enforcement, you'll be doing what you need to be doing. And we are here to help with this as well. Fatigue campaign, I just want to talk about some of the projects that we've had out there. I was quite lucky with my brief when I came into this role. I was in another role within WorkSafe in November last year, was to get some projects up and running. And we did the fatigue campaign. I'll show you. Remember the water bottles? Who saw the water bottles? A few of you, great. So we looked at fatigue, and fatigue was identified by the Charter and industry as one of the key issues out there for them. How do they manage it? So we looked in impairment. The alcohol and drugs is a big one out there. We're not talking about that today, but it certainly is a huge issue. So look, over a 3-week period, we delivered 2,000 water bottles to industry, and the inspectors and the ACC injury prevention staff did that. And they also did some toolbox talks and some one-to-ones with workers, because I think one of the biggest challenges we have as a government is to get in front of workers. We're quite good at talking to managers, and we can sometimes get in front of foremen, but we do have a bit of a challenge getting in front of the workers. So it was quite interesting. We'd rock up in the WorkSafe car, which is very branded, obviously, and the guys and women would stand there and look at us like, oh my God, who the hell is this? Bloody WorkSafe. And then we'd, they'd not look at all keen. So out we'd hop, and I brought some of the inspectors with me. They were all a bit younger than me too, which helps. And the guys, and we'd say, would you like some water bottles? And the guys would go, oh yeah, cool. And so it was an opportunity to talk to them and to see us in a role that wasn't just enforcement. And in fact, most of the inspectors sitting here were involved in that. And it was a chance for them not to work in an enforcement role too. So I think it was a really good campaign. We've had a lot of good feedback from it. People are still asking for it. We worked with ACC, and I think that was really important for people to see us working together. So that was a really good project, and it's an ongoing one. Still a big issue out there. People are really tired. What I found this time was that coming back from Christmas holidays, like I had 3 weeks off, that was a luxury. When I spoke to workers, they said, oh, we've only had a few days off. They were really tired. And I find now, out talking to them, they're still really tired, and they're looking forward to Easter. So don't make them work over Easter. Give them a bit of a breather. So there's the bottles. They're out there, you'll see them. There's still a lot floating around, hopefully. The other one we've had is the occupational health van. Who saw that? Or did it come to anyone's site? Yep. So look, we contracted Tri-X to do that for us, and we had 2 occupational health nurses. Nobody would come near us if we put WorkSafe on the van. They think we were a drug van, and they would have all scarpered, no doubt. So that was a project that was managed for us by Tri-X, which was great. And they went to 30 sites and saw over 400 workers over an 8-day period. And that's pretty good, isn't it? It's a really good hit. And I think, again, it's getting in front of workers, and that's what we were able to do with this project, which was really good. They did a mini health check. Some people thought we were going to rock up and do a full health check and save them lots of money. Unfortunately, we didn't have the resource to do that. It takes a good half hour to 40 minutes to do a respiratory, hearing test and blood pressure and education. So it was just a mini one. ACC supported us. We had a number of barbecues. We did a lot of toolbox talks, and we've had good feedback from industry on that, and it is something we'd like to repeat. And the possibility is that we could do it with industry, maybe a joint project. So maybe some of you big players could think about that. CTV, I got my 90 minutes of fame. 90 seconds. God, who'd listen to me for 90 minutes, for God's sakes? 90 seconds of fame on CTV. It was CTV, it wasn't even TV1. Anyway, it was CTV, which was cool. And so what we thought we'd do is just show you the clip, because then you don't have to listen to me waffle. You can listen to me waffle on that. So, and there's a few other people in here whose faces will appear as well. So we'll show you the clip, which was at the Fulton Hogan site, where we had about 25, 30 guys, and we had a barbecue as well, toolbox talks, etc. So should we show that?
With the rebuild happening in the construction sector booming, safety has been a concern across the industry. But from this week, the health of workers is also being targeted, and a new incentive is helping to get workers in good check for their big job ahead. Jared McCulloch reports.
Health is the focus here at this worksite, with employees receiving free health checks and advice as part of a program through WorkSafe New Zealand. 25 Fulton Hogan workers took advantage of the health checks, informing them on the importance of staying healthy. And the project manager says it's all about improving the health and safety.
So the van will be offering free health checks, just a mini health check of hearing, a quick blow into the peak flow meter to see how their lung function is, and blood pressure and grip strength. Also some education around occupational health, construction in particular.
The construction company's safety manager says it's great to see this initiative being rolled out, and it's great for Fulton Hogan to jump on board.
Fantastic as any workplace in Christchurch knows. When you see the drug van come up, it's really a negative thing, but this is absolutely positive, and the guys I've just spoken with the teams now, they're extremely happy about this. They've got water, they've got fruit, they've been able to do some very elementary health checks. It's been fantastic.
And he says it's a great move to put extra awareness on a growing issue.
I think it really helps to promote it, that it gives a very good image. It says that we're all out there together trying to make sure that we all go home safely together. So, no, it's very good.
Donna says there's two main areas WorkSafe is focusing on. One in particular is dust-related problems.
Like you might have your silica dust, your asbestos dust, you might have solvents, fumes, any chemicals that can potentially get into the atmosphere. So anything that anyone can breathe in, and noise, they tend to be the two top ones that we're seeing a lot of people getting sick or injured from with hearing loss.
Statistics show up to 900 people die every year from work-related diseases. That's compared to around 75 who pass away in the workplace. And Donna says the large number of illnesses are down to poor health initiatives. However, she says it's getting back to the basics that makes all the difference for improved health in this industry.
Big thing is, if you've got personal protective equipment, put it on and wear it, make sure it fits properly, and then get your health checked, get your lung function checked, get your hearing checked on a regular basis, work with your employer to get that done. Remember the basics and then add on the rest of the stuff that you need to be doing.
Fulton Hogan has a full-time health professional on hand to help staff with any issues they have, and she says it can make a real difference.
My primary focus is health checks, so all of our guys and girls have a health check at least once a year. We then review them 3 months later to check hearing again, and then again in a year's time.
But this may not always be easy for smaller companies, and the big aim for Donna?
To get the information out to people, raise the awareness, that'll be the big thing. And for employees to be able to say, hey, look, we've had this information, and go back to their employer and say, look, what can we do about this? Can we get some health programs in place? So it empowers the employees to be able to do that, and it also gives the employers some information, because a lot of the people we're seeing are small business, so there might only be 3 or 4 guys on site, and so that employer often doesn't know what he needs to be doing. So this is a chance to get in front of him or her and say, look, this is what you need to be doing, and get that education out there.
Around 400 construction workers will see this van popping around the city as it continues its journey for the next 2 weeks. Jared McCulloch, CTV News.
Great, so that gives you an overview of what happened with the van. So hopefully it's a project that we can extend. I do think there is the demand out there, and it'd be good to see it up and running again. There we go, there's one of the nurses and one of the Fulton Hogan, so that was just getting his blood pressure checked there. Okay, so well, look, when the inspectors are out there, I think a lot of you wonder what we're doing in the occupational health space. I think, with occupational health, we can still treat it the same as safety in a lot of ways with this model that you should be using out there, that you're identifying what your occupational health hazards are, you're assessing them in the risk assessment to put that in there, what is the potential risk, and looking at controls. And, don't go straight to personal protective equipment, because that's what we're seeing in the industry, and in fact most industries. People put hearing protection on, they put respiratory protection on. I mean, that's cool, but there's other things that you can do, okay? Noise, you can maintain your machines really well, keep them sharp, look after them properly, then they're not so noisy. Do you have to use the noisiest machine to do the job? With dust, can you use water suppression? Can you use extraction systems? Do those things. Don't go straight into the personal protective equipment. And that's what we'll be talking to you about over the next few months with Silica. You've got to document things. If it's not in writing, it doesn't exist. You'll know that. And if we come and talk to you about how you're managing your occupational health, it certainly helps if you can show us some information about how you're doing it. and monitor things, okay? Put everything in place, manage your occupational health, and put some health monitoring programs in place, which I'll talk about, and make sure all those controls for noise and dust, etc., are working. Don't just do it and hope for the best. So our inspectors are going to come on site. They are already coming on site with occupational health. We're doing it as part of construction at the moment at selected sites. They will be looking for this approach. So feel it reasonably straightforward. It doesn't have to be complicated. I think people look at occupational health and go, oh God, I just don't know where to start. Use the same model that you do in safety and focus on one thing at a time. You know, get your noise sorted, get your dust sorted. Don't try and do everything because it's just not possible. You just can't do it. And get some help. Okay, hazard management. Everyone got hazard management systems in place? God, I hope so. The Act's been around for 20 years, remember? It's not new. So they're the things you need to be doing out there. Talk a bit more about that in a minute. When we go into workplaces, I mean, that's not me. She looks a bit, she hasn't got as many wrinkles as me. That's how I feel, and I find that people just are really blasé about noise. They just think, oh, that's always noisy. What are you on about? And the inspectors go in, and sometimes we just sort of think, oh my God, it's so noisy in here. And one of the worst things we notice is the radios. They're so loud, and they're often way above the 85 dB. In fact, they're often around 100. And often I have to ask them to turn it down because I'm a bit deaf anyway. But I certainly cannot hear when I've got a radio blasting in my ear. So I just don't know how people manage at work sites. It's so noisy. Okay, when we're talking about dust and noise, it is a good idea if you can, and it's going to be a bit difficult in construction sometimes to do some of this, is to do some surveys and to look at what the actual exposure is for people. What noise levels are they exposed to? What dust levels are they exposed to? And so we do encourage you to do that. It's in the code of practice for noise that you do noise surveys. You can do a preliminary one. Has anyone got the app that you can put on your phone? Does anyone use that? Yeah, that's quite good. Cool. There's a free app that you can download from the App Store if you've got an iPhone. Or I suppose the other phones do, I'm not sure. And it's free. And it gives you, it's just a preliminary, it gives you a good idea. And I mean, I've sometimes just stood with a worker and said, look, this is the noise, and showing them on the app. And they've gone, oh, God, I didn't realise it was so noisy. So that's a really easy tool, and it's free. And that gives you the idea, hey, there are things here that need to be managed. It's a good education tool before you do a big survey. And you may need to do a big survey as well. And the workplace exposure standards, you know, we may be asking you to do an exposure assessment. I know some of the bigger players have, around silica in particular, or general dust, welding fumes. So there are exposure assessments that you may need to do to see what's actually going on. And remember, the exposure assessments are also a way of testing if your controls are working. So you can put your controls in place for like your dust and your noise. Then if you do a survey, you can see if it's working. That's part of your monitoring process, really important. I'm not making it up. You've probably worked that out, hopefully you've worked that out. As I said before, it's been around for over 20 years. Section 10 of the Act is a legal requirement in there to do health monitoring. It's quite straightforward, you do it. I mean, it's not the most straightforward Act, I'll be the first to admit that. But it says in there, if you can only minimise a hazard and put personal protective equipment on people, you legally have to monitor their exposure. So the inspectors, we can easily come out to you and say you must do this, and we can issue notices for it. At the moment, we're still working with an engagement and education focus with the construction sector around this topic. Anyone from manufacturing sitting in here, they get notices issued on this. We've been a bit tougher with them, but the construction sector's just had so much going on that we have elected to step back a wee bit with this. So I'm not making it up. It's a legal requirement, monitor people's health. Is that all? No, there you go. I thought I'd finished, Kate. There's a man all dressed up, obviously. Hearing and noise, we've talked a bit about that. Make sure it fits properly, training and education. We see hearing protection, like I think, one of the nurses on the van spoke to me the other day, and she said, a worker came to her and he said, I've got really sore ears. And she had a look in his ear, yuck. And she said, oh, you've got an ear infection. Can I have a look at your hearing protection? And he showed them to her, and she took the pads off, and they were all mouldy. And we all go, oh, yuck, that's revolting. But that's not probably that unusual. And he was a young guy, and he said, oh, I didn't know that came off. Didn't know you could change them. So he had an ear infection from dirty, filthy hearing protection that was never being looked after. So the foreman out there, oh God, I keep knocking it. The foreman out there and the more senior people, make sure people know that you can change the pads. And if you're getting hearing tests done, that's a great time to put those hearing protection in front of the occupational health nurse, who will also talk about the need to change those pads. That's what occupational health nurses do. They don't just do a hearing test, they do education. And most of your people will never, ever be in front of a health professional. And that was one of the main reasons we got that van out in front of people. So think about that. Some of you probably go to the doctor if you tweak your ankle. Most of your workers never go near a doctor because, one, they can't afford it, and two, they don't know that they need to half the time. Okay, Kate's waving at me. There's someone with all their gear on. Note he's had a shave. I was talking to some workers the other day and giving them a bit of a demo with this sort of thing. And they were the hairiest bunch of men I've ever seen in my life. There's no woman there, rest assured. But and I said to them, "Oh, do you wear masks?" And they said, "Oh, yeah, some of us do, you know." And one guy was so hairy, I couldn't have even got a mask on him. And he said, I don't worry about it. He probably thinks his beard filters the dust. Well, I can assure you it doesn't. So, so we've got a bit of a challenge out there, people, I think. So everybody needs to have a shave and get the hair off their face. So all those hairy people in here, think about that. Hearing and noise, I've talked about that. You don't need me to go on about it. But just look, when you get those results from the occupational health nurses, and I would encourage you to use occupational health nurses for your testing. I'm a bit biased because I'm a nurse. But, make sure you use qualified people. Follow up on results. Who gets those reports and puts them in their filing cabinet and hopes for the best? Some of you. There's a lady getting a hearing test. Code of practice, hopefully you know about it. Find it if you don't. Respiratory program, I've talked a bit about that. And it's not just a lung function test. There's a few technicians out there just doing lung function tests. That's not good enough. There also needs to be a respiratory questionnaire that is done with that lung function test. It gets done every year, and that gets a work history, it gets an exposure history, and it gets a smoking history. There's too many people out there blowing this machine, and that's the end of the test. That is not a lung function assessment. There we go, that's what you do. You blow in a machine. Takes a few minutes. And that's me. Thanks, people.